Hello, I'm Dr. Joseph McHale, Chair of the American Society of Hematology Committee on Communications, and I'm here to give you some helpful guidelines for presenting at ASH meetings. The ASH annual meeting and educational meetings throughout the year are celebrated for offering a dynamic exchange of cutting-edge scientific research and clinical updates in the field of hematology. New and experienced presenters alike can always work on improving their presentation skills and slides. In the next few minutes, I'll review 5 critical guidelines for delivering quality presentations at ASH meetings. Let's start with things to avoid. We all know a terrible slide when we see it. Presentations are fundamentally about communicating information clearly and concisely. So, step 1 is don't make slides that are too busy or unreadable. In fact, I call busy slides lazy slides. They may take a little bit more time to prepare, but clear and concise slides, dark font, on a white background, 20-point font size or larger, can go a long way toward making a presentation effective. The next thing to avoid pertains to copyright and patient privacy. When you present at ASH meetings, you agree that you have obtained permission to display all visual materials that appear in your slides. So step 2 is don't violate copyright or patient privacy. Everybody loves a New Yorker cartoon, a movie still, or a comic book superhero, but understand that these are copyrighted images, and if you use them, ASH will need to redact the entire slide. Likewise, pharmaceutical and other commercial logos are not allowed. Also, be sure to remove any patient identifiers from slides showing lab work, x-rays, or any other clinical data. Provide complete citations for any images or information from other publications, including lead authors, article and journal title, publication date, and page numbers. There are a few more things you can do to ensure a top-notch presentation. Step 3, do take time to attend to your conflict of interest disclosures. Prior to the meeting, update your COI disclosures online using the link that ASH sends you by email. ASH will use this information to create a COI slide placed near the beginning of your slide deck. During your presentation, it is important that you pause on that disclosure slide long enough for the audience to read it, and follow any specific instructions you've received from ASH about oral disclosures. Be very clear in your presentation to indicate when you are discussing off-label uses of a drug, and always use generic names of drugs on your slides. If you must refer to a brand name drug, place the generic name beside it in parentheses. Your talk consists of much more than slides alone, so step 4 is to know and connect with your audience. Please don't read slides aloud word for word. And however engrossing your work may be, don't forget to look up. You may be presenting in a large auditorium to hundreds of people where it's important to make eye contact with members of the audience, whether they're front and center or in the back row. It's also important that you anticipate an international and broadly diverse audience and take steps to communicate across any cultural differences, rather than presume similarities of perspective and experience. With that in mind, make sure any humor used is appropriate to the audience. The last step to delivering a successful presentation is to practice and prepare. Have a colleague review your slides in advance for accuracy and legibility. They may also discover typos you missed. Rehearse your talk and rehearse it again. When preparing your slides, a good rule of thumb is 1 slide per minute. For example, for a 20-minute talk, you shouldn't have more than 20 to 25 slides. Keep track of the time during your presentation to ensure that you finish on schedule and have time at the end for questions. Finally, be sure to follow the instructions sent to you about submitting your slides to ASH in advance of your presentation. There you have it. 5 simple guidelines for preparing and delivering a successful presentation at ASH meetings. Well, thank you for watching. We look forward to seeing you and your great presentations at a future ASH meeting.